Today's program highlight features the Psychiatric Emergency Services Urgent Care Clinic. We're meeting with Amber Ryan, Practice Manager for Psychiatric Emergency Services, to learn more about how it supports our community. What is the Psychiatric Emergency Services Urgent Care Clinic?
Great question. So Psychiatric Emergency Services is a walk-in clinic for people in the community who are experiencing a mental health crisis. And a mental health crisis might be something that you feel like you are struggling to manage on your own. You might be feeling overwhelmed or stressed out. A lot of our clients sometimes might be experiencing thoughts of harming themselves or harming someone else, or experiencing symptoms that are unmanageable from a mental health perspective. So we are open 24/7, and our role is to meet with clients that come in our doors and provide crisis resolution services for them.
What does a typical visit to Psychiatric Emergency Services look like?
So when you come in the door, you'll be greeted initially by security. They'll ask you why you're here, who you're here to see, because there are multiple programs in our building. You can let them know that you're here for Psychiatric Emergency Services, and they'll let you upstairs. Once you get upstairs to the main lobby, there is a person at the triage desk who will greet you and give you a couple pieces of paper to fill out. It gives us more information about your presenting concerns and what types of services you're hoping to receive. After you fill that out, we'll do a screening with you. It takes about 10 minutes or less to complete the screening. And then that helps us determine if you need to meet with one of our counselors for a further assessment, or if you're just needing resources for the community. Sometimes clients come in and they might be too acute for our clinic. So we will then work with the client to get them connected to the level of services that they're needing, such as a higher level of care. Most of our clients that come in are referred for further assessment, in which case you'll meet with one of our counselors on a one-to-one setting in an office. The counselor will meet with you and ask you some questions about what's going on, what types of symptoms you're experiencing, and together y'all will work to create a disposition plan or an outcome based on what you're needing and what services are available for you. We then can coordinate either with hospitals if you're needing a higher level of care. We have prescribers that are here 24/7, so you can meet with somebody to talk about medication services, or like I said, we can provide resources for referrals to the community if you're needing connection to those type of services.
What are some of the services and supports offered at the Psychiatric Emergency Services Urgent Care Clinic?
So here at Psychiatric Emergency Services, the main service that we offer is a crisis assessment, where we sit down and meet with you, talk about what you're experiencing, and help come to a resolution that hopefully lessens the crisis that you're experiencing or resolves the crisis. Other services that we offer include 24/7 prescription management, so you can meet with an emergency prescriber and talk to them about medication. If you lost your meds or you ran out of your meds, or even if you haven't ever been on meds before, you can meet with one of our prescribers and have that conversation about getting started on meds. We also can meet with you to provide some brief crisis counseling. If you're experiencing a crisis and just need a place to talk to someone, we can do some crisis management in that respect. We can sit down with you and create a safety plan if you're not feeling safe in the community. And of course, we can evaluate you for a higher level of care, such as hospitalization or stabilization in our crisis residential units, or our 23-hour observation unit based on what your needs are. This is one of our rooms in our 23-hour observation unit. Folks can stay here for up to 23 hours while they're waiting to connect to additional resources. They'll meet with one of our prescribers to get started on medications, and the counselor will work with you to determine at the end of 23 hours if you're needing a higher level of care or additional resources, or if you're feeling safe to return to the community. This is our child and family room. AISD actually supported the funding for this room so that kids and families who present to PES will have a safe place to wait. We also can utilize this space for folks who are maybe needing a little extra privacy or feeling a little bit elevated and need a calm place to relax while they're waiting to be seen.
Where and how can someone in Austin or Travis County access the Psychiatric Emergency Services Clinic?
So Psychiatric Emergency Services is located at 1165 Airport Boulevard, which is just south of 12th Street on Airport, located in East Downtown Austin. We are open 24/7. We accept walk-ins, so anybody can present to our building and be seen. A lot of times ERs, local ERs will refer to us, or law enforcement or EMS will refer to us as well. We also work with community partners such as the Sobering Center, the Host Team, which works with individuals who are unhoused in downtown Austin and surrounding areas. We get a lot of referrals from our 24/7 hotline. So clients call the hotline experiencing crisis, and the hotline will refer them to PES to be seen. We work with any individual who is experiencing a crisis in Travis County, whether you are a resident or not. Our services, like I said, are walk-in. They're completely voluntary, so nobody's going to force you to do anything that you don't want to do. And we're here to support you and try to come up with a solution to help you get to a place where you're feeling better.
Thanks, Amber. Remember, Integral Care's 24/7 helpline is available for free emotional support as well as connections to local resources. Call us at 512-472-4357.